Welcome, future IBCLCs. You're in the final stretch of your exam prep, and we're here to tackle a topic that is absolutely going to show up. So let's dive right in and make sure you get these points. Does your heart start to pound a little faster when you see words like odds ratio or study design on a practice question? If it does, trust me, you are in good company. A lot of candidates feel a little shaky on research and stats. But we're about to fix that right here, right now. In the next few minutes, we're going to nail down one of the most common study designs you'll see so you can walk into that exam feeling totally confident. Okay, section 1, let's call this the research snapshot. So what in the world is a cross-sectional study anyway? Here's the easiest way to think about it. It's a snapshot. Like you're literally taking a photograph of a group of people at one single moment. It's not a movie showing what happens over time. It's a freeze frame of what's happening right now. So let's make this real. Imagine you grab a group, say mothers with 3-month-old babies. Then in the very same week, you ask them about two things at once. An exposure, like are you using a nipple shield, and an outcome, like are you having nipple pain? You're looking at everything simultaneously to see if there's a connection. All right, part 2, decoding the numbers. So you understand the study design, but what about all those stats they throw at you? Let's break down the only two numbers you really need to get for these studies: odds ratios and confidence intervals. Don't let a table like this intimidate you. It all boils down to two things: the odds ratio, which we call the OR, and the 95% confidence interval, or CI. And for both of them, the magic number you need to burn into your brain is 1. It honestly is this straightforward. If the odds ratio is bigger than 1, that means there are increased odds of something happening. If it's less than 1, there are decreased odds. That's it. Let's try it out. So, a study on PCOS and milk supply finds an odds ratio of 3.0. Okay, stop right there. 3 is obviously bigger than 1, so right away we're thinking increased odds. So what does this tell us? It means the odds of having low milk supply are 3 times higher for these moms. Now, here's the really crucial part. Look at that confidence interval. The range is from 1.8 to 4.2. Notice what number is not in that range? The number 1. Because the range doesn't cross 1, we can say the result is statistically significant. It's likely a real thing, not just some random fluke. Okay, section 3. Everybody lean in for this one. This is, without a doubt, the biggest trap the IBCLC exam will set for you on this topic. Getting this one concept is key. This phrase right here is gold. You have to memorize it. A cross-sectional study can show you that two things are connected, that they're associated, but it can never ever prove that one thing caused the other. Look, these studies are awesome for some things. They're fast, they're cheap, and they're great for figuring out how common an issue is. But, and this is a huge but, their major weakness is that you don't know which came first, the chicken or the egg. Did the nipple shield use lead to the pain, or did moms who already had pains start using a shield to cope? This study design has no way to tell you. And now for section 4, the final drill. We've talked through the theory, but let's lock it in with some real exam-style practice. This is where the rubber meets the road. All right, question number 1. Read it carefully. What words are jumping out at you? For me, that phrase, "at that single point in time," is like a giant flashing neon sign. And the answer is C, cross-sectional study. That phrase, "single point in time," is the dead giveaway. It's our snapshot. You got this. Okay, next up, odds ratio is 0.60. First thought, is that bigger or smaller than 1? It's smaller. Okay, now look very closely at the wording of those answer choices. The specific verbs they use are everything. And the correct answer is B. Since 0.60 is less than 1, we know it's decreased odds. But the key here is comparing B and C. Answer C uses the word causes, and we know that's the big no-no. B correctly says it's associated with. Perfect. All right, for this one, all of your focus should go right to that confidence interval. The range is 0.9 to 2.1. Now, what was our magic number? Does this range cross it? The answer is D.
That range goes from just under 1, 0.9, to over 1, 2.1. Because the number 1 is inside that range, we can't be sure if there's a real effect. It could just be chance. So, the result is not statistically significant.
This question is basically asking, did you get the main take-home message? What is the number one absolute biggest weakness of this kind of study? Yes, you know this one. It's C. It's that inability to establish a temporal relationship to prove that the cause actually happened before the effect. This is the core concept you have to remember. Last one, this is a more general statistics question, but one you'll definitely see. When you see the names of fancy tests like a t-test or a chi-square test, what is their main purpose? What are they trying to do? The answer is D. Think of all those different statistical tests as tools in a toolbox, and their main job is to help us figure out if a result is the real deal or if it could have just happened by a random fluke. They're all about determining statistical significance. And there you have it. You've just built a solid framework for knocking these questions out of the park. You can spot the design, you can interpret the numbers, and you know the number one trap to avoid. From here on out, whenever you read a study, just ask yourself, is this showing a real cause or is it just an association? That simple question will make all the difference. Good luck on the exam. You are going to be fantastic.